Welcome to another session with Trial Join. In this session, we'll be covering the best ways to increase principal investigator involvement in clinical research. A PI, or principal investigator, is a person responsible for everything that happens in a clinical trial. Their name is listed on the official FDA documents. These are the guys and women that are in charge of maintaining sites' good clinical practices. These are a set of rules that the FDA has established that ensure patient safety and privacy and other considerations. While PIs often do delegate a lot of their tasks to other staff members, they're the ones solely responsible if anything does go wrong during a trial. These things that can go wrong are usually adverse events when patients are experiencing something that's not typically supposed to happen with the medication, and they're supposed to report this to the sponsor and take care of the patient. PI oversight, especially over their staff, is one of the most important practices to ensure a successful trial that collects all the data necessary to make the trial successful and potentially go forward into the next phases. This is why many site owners that want to work with PIs want to help them improve the oversight. Since PIs again do delegate most of their work, at certain points you really have to talk to them and get them involved with the trials and really make them be participating and working with the coordinators. Otherwise this can cause problems later down the line when significant issues do occur. So if the PI doesn't own the research site and you're hiring them as a third party, make sure you have their buy-in and you're constantly making them work with you. There are a few reasons why PIs don't get more involved. The first example is when they own the research clinic but aren't getting too much money from it. Unfortunately, they'll focus on their private practice and let the research site fall to the wayside. But this is tricky because if they're not giving in the proper amount of time, they're not going to see any income generated from the research site. So it's a catch-22 of sorts. The second example is when the PI is employed elsewhere and they don't own the research site. So they could be employed by a university clinic or work for another site. That might mean that they're spread too thin and they're not able to properly give the attention necessary for the trial. So how do you increase PI involvement? Figure out what the principal investigator wants and get it to them. Do whatever is necessary to increase their oversight and involvement in the trial. Then secondly, simplify and make things easier for the principal investigator. Streamline your workflow, do whatever it takes to create checklists and improve your standard operating procedures, and have your coordinators take on as much of the work as they can before having the principal investigator get involved. Try all the simple things. There's a lot of low-hanging fruits that you can go after to make the process streamlined and easier for the principal investigators. And at the same time, principal investigators are often busy with their regular practices, seeing patients, so you have to really adapt your ability to their schedule. Make sure you're doing everything they can to make life easy for them. Work with them once a week to figure out what their schedule's like and how you can adapt the clinical research schedule with them. And the last thing is give them more benefits. Get them feeling like the research site is part of theirs, it's part of your partner with them and not just an employee that you're hiring to conduct the research. So really get them to buy into it. There's different ways you can go about this. You can get the PIs where they have more equity interests. This is of course cases where the PI doesn't own the research site itself. So get them to buy in through multiple ways and different incentives, different structures. There's multiple ways you can work with this. And basically, if you don't have a PI that's not properly motivated or compensated, you'll have a PI that's not doing the best work possible. And we do want the best work because that's how you're going to get subsequent studies and sponsors are going to recognize you. So you really want to give it your all and make the PIs buy in and have it synchronized with your other staff, your coordinators, so that way there's a good workflow. It's all streamlined and makes it easy for everyone, makes it so you can get more patients, more studies, and have a successful clinical research site. Thank you for watching. We hope to see you again. Bye.